President, earlier this week, some Republicans, I think the Republican Study Committee, 170 House members, released their plans for governing next year. And here are some of the things on their health care wish list. Ending Medicare as we know it, which would drive up costs and threaten care for seniors. Trying again, I think we're now on to 50 attempts, to gut the Affordable Care Act, leaving tens of millions of Americans without coverage overnight and punishing people with pre-existing conditions. And banning abortions, IVF, and contraception in every single state through bills, quote, designed to advance the cause of life. If budgets are statements of a party's values, then Republicans are making no secret of theirs. Less access to quality health care and less control over their personal health. And there's no reason not to take them at their word, other than that if we take them at their word, you sort of sound like you're exaggerating. That's the problem, is that what they are proposing is so outlandish that it sounds like, as a Democrat and someone who wants my point of view to win the day, it sounds like I'm exaggerating their point of view. I actually had to read this stuff from the Republican Study Group, and they are way out of the mainstream, way out of the mainstream. Again, no reason not to take them at their word, because in Congress and in state houses across the country, Republicans say what they want to do, and then they do it. It doesn't matter how cruel these policies are, how unpopular their positions are. They have not been able to show any restraint whatsoever when it comes to enacting this extreme agenda, and it is extreme. Millions of Americans are left to endure the disastrous consequences of this crusade every day. If Republicans have their way, millions of people will lose their health care. Seniors and people with pre-existing conditions will be forced to pay outrageous out-of-pocket costs just to get life-saving procedures and medications, and young people will be kicked off of their parents' plan immediately. And women across the country will be forced to carry doomed pregnancies to term. Families trying to start a family will have one less option, at least, with IVF not even available to them. This is not what we should be fighting for. We have to work to get more people covered, because high-quality, low-cost health care should not be a luxury available to some. And frankly, and I believe this, there is going to be a point where we don't fight about health care anymore. There's going to be there's going to be a point at which Republicans realize that taking away people's health care, taking away people's autonomy as it relates to their own bodies, is just an electoral loser. We're getting there on Obamacare. I thought we had kind of gotten there after multiple attempts to repeal it, but here they are again, trying to start that effort again. Democrats are focusing on lowering premium and prescription drug costs so getting health care doesn't bankrupt people. And even the Republicans in Washington and across the country, as they try to control women by dismantling reproductive freedoms, Democrats are fighting to codify Roe into federal law. Democrats have done more than just give speeches about health care. We've actually delivered. It was 14 years ago that we passed the Affordable Care Act, which has since helped more than 40 million Americans get their coverage and improved health outcomes for so many people: women, children, seniors, people with disabilities, people in rural communities. And so it's no wonder that more than a decade later, the ACA continues to grow in popularity and is setting new records every year for enrollment. Why? Because people actually like having health care. Republicans, Democrats, independents, voters, not voters, everybody basically thinks that we should have a system that treats you humanely if you're sick. But it hasn't stopped Republicans from trying again and again to repeal it through Supreme Court cases, executive orders, and legislation. They have failed every time. Meanwhile, Democrats continue to build on the ACA's progress, including recently with the Inflation Reduction Act and the American Rescue Plan, because there are now tax credits and other measures in those bills that enable millions of Americans to save an average of $800 per year on premiums. And the number of uninsured is at an all-time low. The number of uninsured is at an all-time low. And the reason for that is legislation that we fortunately passed, but we unfortunately did not have a single Republican vote for the Affordable Care Act, for the American Rescue Plan, or for the Inflation Reduction Act. For the first time ever, people with Medicare are paying less for insulin, which is now capped at $35, saving money on a whole range of other prescription drugs. This is what progress looks like. But there are still millions of Americans, especially in the middle class, who don't get coverage through work, but make too much to qualify for subsidies. And they deserve coverage too. The State Public Option Act, which I'm reintroducing today with colleagues in the Senate and House, would help to bridge that gap. It helps to provide a public option to anyone who wants health insurance by allowing states to create a Medicaid buy-in program that's not based on income. State public option programs have shown to lower cost, increase consumers' choice in plans, and improve equity in coverage. Several states, including Maine, Minnesota, and New Mexico, are already exploring creating exactly this kind of buy-in approach. The State Public Option Act would help other states to follow suit. The bottom line is this: health care is a necessity and not a luxury, and it shouldn't be something that the political parties argue about. In the richest country in human history, having it should not depend on your job or your economic status. It ought to be available and accessible and affordable to everybody. The vast majority of Americans agree, but there's only one party today fighting to make it a reality. I yield the floor.